Hello everyone, myself Dr. Rajesh Khanna, Consultant Pediatrician, KIMS Cuddles, Kondapur branch. Today's very important topic that every parent comes very often, frequently almost 70% to our outpatient checkups, that is, my child is having frequent cough and colds. So cough and cold in children is very normal, you will get because children are exposed to adverse climatic conditions, as well as in school their respiratory system is a preliminary thing which gets affected very easily. When one child is sick, it spreads to entire classroom. So cough and cold both goes hand in hand in majority of the times. If the child is having cold, running nose, they usually present with cough as well. Now when do you actually need to worry is when the child is getting more than 8 times in a year. So up to 8 times it's considered as normal, and also apart from that, not just frequency, even if the cough is persisting beyond a week, that is also considered abnormal. And when to treat, see, usually age matters. If the presentation in infant period, that is less than 1 year, even a day or two, you should definitely take the opinion of the pediatrician, because for the complications to set in, it hardly takes hours and days only. But for older children, more than 1 year, you can wait for a day or two. It usually is self-limiting and it's not that harming the child. But if the cough is so intense that the intake is affected and child is vomiting and cough is so vigorous, usually it can also be a part and parcel of asthmatic condition as well. So if it is purely viral upper respiratory infection, we tend to give only saline nebulations and try to consider if it is spreading to the lungs, that is lower respiratory tract also is involved. If lungs are involved, that is pneumonia is setting in, we have to be very cautious and we have to monitor the child by doing hospitalization. Otherwise else, if the child is having up to 8 times in a year, usually simple remedies are sufficient. Now when the child is getting more than 8 times, up to 12 times, the child needs frequent health checkups, investigations, and proper advice, dietary advice to be followed, that is avoiding all refrigerated items, all the outside junk foods, and avoiding travels, especially to colder climates and adverse climatic conditions also, not exposing the child to bad weather. And when the child is not doing well, better the child be isolated and stayed at home rather than sending to the school and letting it spread to others. Now if it is more than 12, definitely it is an abnormal thing and child needs evaluation. If it is a component of hyperreactive airway disease, or if there are adenoid swelling inside, tonsil swelling, as well as if the child is developing asthmatic kind of condition, and also if the child is allergic to certain factors, so then we need to diagnose accurately and find out which is triggering such cough and cold. Most commonly these days, due to excess construction works, due to dust exposure, the child is getting too many episodes of upper respiratory infections as well as lower respiratory tract infections. Simple usage of air purifier and less usage of air conditioner can help you all in curtailing such situations. We have beautiful probiotics as well, respiratory probiotics, which helps in reducing the frequency of cough and colds. Now usage of common cough cold preparations is definitely not advisable, especially at the parent level. Most of you start using the medicines for days together, and it has got so many side effects. In fact, the child may not have any problem with cough and cold as a complication, but usage of medicines can create so many complications, heart rate fluctuations and brain circulation problems. So there are a lot of issues when you use. So pediatrician will be the right person whether to use or not. That is most important. Simple usage of medicine is not a wise decision. So kindly follow pediatrician advice before you treat such cough and cold episodes. Thank you.